Hi, everyone. Thank you so much for joining us today for our session on integrated watershed management for climate-resilient public health and ecosystems. My name is Dr. Amelia Wenger. I lead the water pollution program at the Wildlife Conservation Society. And today we're going to hear from a range of speakers and panelists on integrated watershed management, both in the Pacific, but also hearing perspectives from other locations. I'm not going to spend too much time up here today because there's much more interesting people who are going to be giving you an overview. So I wanted to introduce our first speaker. Her name is Ama Wakwela. She's just recently submitted her PhD thesis, which is a wonderful accomplishment, at the University of Queensland. Her PhD was in partnership with the Wildlife Conservation Society. Ama is interested in cross-sectoral management approaches for conservation and how they can be used to deliver benefits for both humans and ecosystem health. So Ama is going to give you an overview of the state of science about what we know on how ecosystems and environmental degradation and watershed degradation influences both.
Thank you, Amelia. All right. So as Amelia mentioned, I just submitted my PhD. I'm super excited to be talking about it. And Amelia is actually one of my supervisors, one of 6, just to give you an idea of how doing this kind of interdisciplinary research worked. It takes a lot of collaboration. So I had experts from epidemiology to ecosystem health to modelers helping me out with this. And a lot of different support from lots of different organizations as well. But before we get really into it, I thought I'd start with why we're looking at watersheds in the first place, often called lots of different things, catchments or basins. These are basically the areas of land that water collects over when it rains. And so this can be really quite small and a little bit simple, where you've got the catchment, for example, for your rainwater tank, where your catchment would just be the roof that drains the water into your rainwater tank. But this can also be a really big area spanning thousands of kilometers. For example, maybe the catchment or watershed for a coral reef. So it would include the entire upstream area on land, which might span from the ridgetops of mountains all the way downstream, where water gets funneled into streams, rivers, lakes, and then down into the oceans as well. And so as we know, hydrological systems are impacting the water cycle, and this impacts our watersheds as well. So we're seeing huge changes in the amount of rainfall received by catchments all across the world. We're also seeing changes in the way that soil can retain this moisture, and also seeing changes in the number and the intensity of extreme rainfall events and other weather events like droughts, which change the ability of watersheds to provide water in sufficient quantity and also quality. In addition to climate change, well before climate change, we also have impacts that human developments have had all across land on our quantity and quality of water. So for example, human development and impacts like irrigation, agricultural clearing, wastewater pollution as well, all impact the quality and quantity of water for well-being, not just for humans, but also all the other species that we share our planet with. So this is a really widespread impact now, and quality makes up a really important part of this story, water quality. So for example, there's been a lot of interesting research that's come out looking at mapping water scarcity around the world, more traditionally looking at scarcity in terms of quantity, but then including some of the quality aspects as well. And what we see is, this is just using some information from 2010, but there's been updates of this data as well, more recently, looking and projecting it into the future. And what we see is that if we only consider quantity, we're considering less than half potentially of the actual water scarcity that is happening all across the world. And the impacts of clean water scarcity are disproportionately impacting areas in the global south. And what the projections into the future are finding is that depending on what our socio-economic development pathways are, depending on what our emission pathways are, we might see some of these numbers triple. And additionally, the impacts are also disproportionately related to the impacts of water pollution when we're looking at this scarcity. So water pollution is a really important part of the story in regards to providing enough water and safe water for humans and all the other species on our planet. So when we're trying to address water pollution, really foundational approach is WASH, so water, sanitation, and health approaches. And a lot of these focus at the point of use for humans, by and large. So, for example, improving drinking water at households and communities, improving hygiene and sanitation. But unfortunately, these have had huge, widespread impacts on human health, so massive benefits, including reductions of diarrheal disease, which are a significant driver of deaths, particularly in children under the age of 5. But unfortunately, when we focus at the household and community like this, we are not addressing the sources of pollution and the pollution in our environment. So we still have persistent high levels of pollution in the environment that we and other species interact with all the time outside of households. So this has a huge impact on human health, and it can actually undermine WASH intervention effectiveness as well. So, for example, we can still have persistent waterborne diseases, even in WASH intervention groups. So, for example, there's been cases where we've seen reductions in enteric diseases, but we still have 10 times the amount of cases compared to higher income places, just because of the amount of pollution that's in the environment. Water pollution also impacts the complexity and cost of water treatment as well. So if you've got really polluted environments, this can undermine the ability to install drinking water treatment and other facilities like that. We also have the loss of cultural and aesthetic values of our waterways and our wetlands, which are really important meeting places for many people and can hold significant cultural values. Another important aspect that is lost when we're not looking at environmental pollution is the loss of ecosystems, which are really important recreationally. For those of you who like to go for a walk in nature, I'm sure everybody would enjoy that, but there's also really significant impacts onto biodiversity. So, for example, all the impacts of our watersheds flow downstream, and in the tropics, this can impact systems like freshwater ecosystems, mangroves, which are at the border of land and oceans, seagrass ecosystems, and coral reefs. And these are hugely biodiverse systems. They support so many different species, and they're really productive. But unfortunately, just like for us, poor water quality contributes to disease and toxicity in a lot of these species, and this can even reduce their resilience to climate change. So, for example, coral reefs can become quite brittle under pollution, and this makes them more vulnerable to impacts from cyclones, and it makes it harder for them to recover after these events as well. So we're kind of getting cascading impacts from pollution and climate change, so multiple layers of human influence here. We also see ecosystem shifts, so we can get the takeover of invasive species in some systems. For example, we can go from beautiful coral reef to algal-dominated system where it's not supposed to be, and we get complete differences in the number and the kind of species that we normally see in these systems. And so currently, a relatively recent estimate has found that pollution from watersheds, from land, is a top-ranked threat to over 30% of coral reefs worldwide. So it's a really significant driver of decline. But it doesn't just end there. Unfortunately, the decline of ecosystems, which is a travesty in of itself, also impacts us. So many people live on the coast close to these communities and depend on these communities, and they provide a variety of ecosystem services which come under threat when they are exposed to pollution. So, for example, in parts of the Pacific, up to 50% of the dietary protein is provided by coral reef fisheries, and pollution threatens these systems. So it can threaten our food intake, it can threaten coastal pollution, and also our carbon storage. And these are just some of the services that are threatened by pollution. There is actually quite a big suite. But in terms of food poisoning, for example, we have millions of cases of foodborne disease because of just sewage pollution onto our ecosystems alone. But I'll focus a little bit on some of the climate impacts. So, before that actually, just to give you a bit of perspective into the importance of coastal protection of these ecosystems, the structures that they form on our coastlines provide a significant service of protecting coastlines from storm surges, from waves, and it's estimated that coral reefs, just on a 25-year storm estimate, save $36 billion worth in damages. And this increases when you start to look at larger storm events, like 100-year storm events. It becomes, I think, almost 96 billion or something in terms of cost saving. So there's further implications into climate change. If we start to degrade our coral reefs, it's estimated that by 2100, those big storm events, so the ones that 100-year storm events, we might see 52% more land being flooded without this service. And this impacts millions of more people with flooding as well. We also undermine our ability to store carbon. A lot of these ecosystems store significant amounts of carbon, and their degradation means that we're losing capacity to draw down greenhouse gas emissions as well. So there's a lot of cascading influences, and it's kind of hard to disentangle what all the impacts would be to humans directly and indirectly. And so as part of my PhD, I helped put together a synthesis focusing on the tropics, putting together what the main land-based activities that are contributing to pollution in coastal environments. There's a huge suite of different land-based activities, and each of them can produce multiple different types of pollutants. And it can be quite difficult to then capture what is the source of pollution and how do we address it. But this was just a state-of-the-science synthesis. I won't go into too much detail, but Massive Range is a QR code if you're more interested. But as part of this, walking through the different types of pollution and where it's coming from, we also put together a synthesis. This is just like one section of the big table of the different types of pollutants and what the impacts onto human health are. Directly, economically, for example, in terms of costs with water treatment, but also indirectly through impacts to coastal ecosystems. So this kind of captures a little bit more of the full suite of impacts of water pollution onto coastal ecosystems and onto coastal communities. And so there is clearly an opportunity here for more integrated watershed management, trying to leverage motivation and action across lots of different sectors. So this is something that conservation is very interested in. This is something that public health is very interested in. And so, but it's a big challenge trying to improve water quality over a whole watershed in our environment, especially when we've got really complicated needs of water, complicated needs of human development. But hopefully with a more integrated approach, we can improve water quality in our environments for both humans and ecosystems' health. So my PhD was particularly focused in the Pacific Islands, where they're really at the forefront of this issue of water quality, pollution in the environment. This is just a map of it. I've highlighted Fiji because that's where a lot of the focus of my work was. But there's potential for benefits in improving environmental water quality, not just for coral reefs, but also for waterborne diseases. And so a lot of Pacific Island communities are highly reliant on surface water directly, some of the highest proportions of direct surface water use for drinking in the world. And also these coral reef ecosystems are incredibly important for fisheries, for livelihoods, and for culture. There's also lots of development and pollution happening in the watersheds that are threatening coral reefs, threatening the services, and then also contributing to waterborne diseases. So just as an example, I focused on two critical diseases in the Pacific Islands, leptospirosis and typhoid. There are some of the highest burdens of these diseases in this region. And just quickly, leptospirosis is a bacterial disease. It's a zoonotic one, so you get it from infected animals. And you can get it from direct contact with an infected animal, but also if that animal contaminates soil and water with its urine. And it can survive for a long period of time in soil and water. And so that means that the environment is a really important source of disease. And so understanding where that water is moving, where that soil is moving is a really important part of disease management, but I'll get into how that's looked at later. Typhoid is not zoonotic, but it is a fecal oral disease. So when there is contamination of floors, of soils with feces, depending on the sanitation system, you can get sick that way. So the environment is really important. And what I did a systematic review looking at what are some ways that we can look to the environment, improve the environment to kind of minimize or prevent and control some of these diseases. And as part of that systematic review, this is focusing on literature in the Pacific Islands, identified that, and this is relatively well known for these two diseases, the environment is a really important part of these, the transmission of both of these diseases. So you see really large outbreaks after flooding, after rainfall events, and you also see a huge focus on exposure to water as a lot of these diseases look at. So for example, not just the type of drinking water you have, but whether you're swimming in water bodies, whether you're walking through them, and different activities outside of the household. So this was really interesting and key, that exposure is a focus, and that focusing on a household or a community wouldn't be enough to prevent the different types of transmission for these diseases. But interestingly, when I was looking at if they looked upstream at what was contaminating the environment and water bodies that people might be accessing, very few studies actually looked upstream. So a lot of them were focusing on what is the type of land use or what is the kind of environment right at the house, right at the community. Very few actually looked upstream to consider is there unimproved sanitation upstream that's contributing to pollution? Is there agriculture upstream that is contributing pathogens downstream? And are there ways that we can manage these sources of pathogens to better improve the environment? So there's very little literature basically looking at this. And this is just a little flow diagram illustrating that. For example, in contrast coastal ecosystems, when we're looking at improving water quality, we inherently have to look upstream at what the sources are of pollution to better manage them. So just a real difference in terms of the scales that we're looking at, which made it very hard to kind of try to identify what the overlapping risks are and how to actually work together to improve. So I did identify a few things. For example, in general, soil erosion and pollution were major drivers, underlying mechanisms for the way that pathogens, pollution were being spread. And so they may be a key target in improving outcomes for both human health and coral reef health downstream. And then one of the major outcomes from the research overall was that we really needed multiple different interventions at different scales to kind of get best outcomes. We can't just have something just at the watershed. We need to have tiered, layered, nested interventions, which my colleagues will go into a little bit more. For example, we can't avoid looking at the global scale to mitigate the climate change impacts, but we do need to be looking at a landscape scale. And so some of that is missing from some of the waterborne disease literature, just the few diseases I was looking at. And then we also need to look all the way down to microbial, trying to improve vaccination rates and things like that, depending on the disease. So one of the ways that we can help assess risks can be through modeling. And so for part of my PhD, I developed a Bayesian network, which is a probabilistic model. I won't go into too much detail, but it's a really simple way to kind of illustrate a problem, especially when you've got really complicated disease transmission, where you've got pathogens, for example, coming from the environment, potentially from your home. You've got socioeconomic and demographic risk factors. You've got environmental risk factors. And in the Pacific, for example, you might have a big limitation of data as well. So these models are really great. You can kind of fill in gaps with expert knowledge and add data where you can. It also allows you to develop maps, which is really cool. So you can provide a risk map based on your understanding of the disease transmission. This is just a simple baby Bayesian network that's showing how you might help predict people's contact with surface water based on information from censuses, for example. So I was trying to understand, for leptospirosis in Fiji specifically, how we can better understand disease transmission over large scales. So are people typically getting infected from their environments, or are they typically getting infected occupationally, for example, through agriculture? Yes, this was able to capture a range of data to help do that. And so I went through an iterative process, talking to epidemiologists internally. They did a review of the model, and it came up with a big mess of like this. And I was predicting leptospirosis seroprevalence, which is basically if you've got the antibodies for infection in your blood. So it's an indicator of infection rates in the population, and I was able to validate it with real seroprevalence data, which was awesome. By including a lot of different types of risk factors in here, including some of those environmental ones, which are sometimes not considered. For example, the impacts of erosion and runoff, and what is actually upstream of you. There's a little bit of hydrological modeling in here, for example. I was able to also assess what are the impacts upstream and potentially test some interventions as well to help with decision making. So what are the kind of suite of interventions and spots we can tackle? So I was able to generate some maps from this as well. This is just looking at some of the more populated areas in Fiji. So this is probability of seroprevalence here, so probability of infection, and was able to identify key areas of transmission. And this matches relatively well with existing maps, which was great. But I was also able to delve a bit deeper and develop maps just for some of the sub-nodes in there. So what is the risk coming directly from animals? So how many people are getting it directly from their contact with different animals? How many people are getting it directly from the environment as well, based on what's happening upstream? And so the resolutions here can be improved depending on the kind of data you have. It was a little bit coarse for where I was working, but it was just a really interesting way to get a better understanding of the different sources of risk outside of the household as well. So this is hopefully going to be helping develop a prioritization method for looking at different types of interventions across scales, across a watershed, and looking at how that can improve not just disease outcomes, but then managing our watersheds better could also be providing outcomes for coral reefs as well. And with that, I'll say thanks, everybody, for listening. And I'll be here for the rest of the conference. If you have any questions, feel free to reach out.
Thank you so much, Alma. You can see there's a tremendous amount of work that she's done for her PhD, and I encourage you to follow her on LinkedIn, Alma Wakwela. She'll be posting her papers as she publishes them from her PhD. So Alma gave us a brief overview. She touched on the Pacific and touched on Fiji. And now I really want to hand it over to, where has Alec gone? Oh, there you are. I was like, you're not sitting in your seat. To Dr. Alec Hughes, who's going to tell you more about the Pacific context. Alec is a Solomon Islander and the country director of Wildlife Conservation Society in the Solomon Islands. He leads work on marine, forest, and watershed conservation with over a decade of experience supporting community-led management and government and partnerships in the country. Thank you, Alec.
Thanks. Thank you, Amelia. Is that coming through okay?
Yep.
Okay, hi everyone. My name's Alec. As Amelia said, I'm the country lead for WCS in Solomon Islands. My presentation this morning, that's jumped ahead. So my presentation this morning is really to introduce the approach that WCS is taking in the Pacific, particularly in the Melanesia region, with the integrated watershed management. So I'd like to start off by first just discussing the contrasting paradigms between the way that water management is approached in a Western or developed society, such as in a country like Sweden, versus a Pacific island context. So when we're talking about a watershed or a water management approach in developed countries, we generally, it involves these extensive infrastructures that involve piping, water treatment, and water pumps, things that cost a lot of money. A lot of capital goes into them. The maintenance upkeep is quite high. And so these services are things that people have to pay for to keep them going. In the Pacific, it's very different. None of the above apply, especially in rural settings in the Pacific. So we have a lot of water resources in the Pacific, but the way we access the water supply is really straight from the source itself. So from the riverways, we've got the streams, and we've got groundwaters as well. And because a lot of the Melanesian region is more like in a sort of a rural context, it's beyond the scope of government and government services in terms of putting in place services to assist the people. It's very much left to the rural communities and tribes themselves to access this water. So it's, in that sense, it's free, but also it lacks the quality of care that comes with a more sort of urban water management approach. So, and the last point on the slide there is actually an important point that I wanted to highlight, is that a lot of this land in the Pacific context in which communities are residing is actually customary owned. So it's not under government jurisdiction, but it's more left up to the tribes and the communities themselves to look after. So just a bit more on the context of the Pacific. So we have some serious challenges in the Pacific. The Western Pacific region, which is where the Melanesian subregion is located, has some of the lowest access to safe drinking water sources, with 41% of the population relying on surface water, which is usually untreated. In Solomon Islands, for instance, over 70% of the rural population in the country are accessing untreated water. And for us, and for general services and projects in general, to be able to engage in a rural setting in the Solomon Islands, it's a big challenge is the remoteness and the challenge of the mobility of moving around, engaging with communities, and this also applies with communication. But coming back to the customary ownership of the land in Melanesia, in the Pacific, this is actually something that we recognize this as a strength, because people's connection to land is very, very obvious. It's a very important part of who they are and how they go about with their everyday living. And so these strong cultural ties helps when you're trying to approach a resource management activity or approach in the areas. And usually what you find within an area where you've got a very strong cultural connection to land is that there's a very good or strong leadership in place with the tribal governance of the area and the local sort of governance frameworks that are already established within the area. So just a little bit more on the the context in the Pacific. So as we know, as Ama has made a very clear made it very clear with her presentation, there's this very strong connection between healthy water sources and healthy people. So again, in the Pacific, this connection is very clear. We've got studies that WCS and partners have done, like Ama has already shared, linking poor water quality with the prevalent cases of diarrhea and other waterborne diseases. And unfortunately, one of the issues that we have that's quite prevalent in Melanesia is upland activities like logging operations that modify the watershed catchment areas. And in a place, again, like Melanesia, where there's quite a bit of rainfall patterns and with climate change, it appears to be getting more frequent, this leads to a lot of contamination of our waterways, and this has a very significant impact on the access to fresh water, and this really affects women and children in communities downstream in the way in which they're able to access the water. So what it generally means is if a community or a village that has a waterway coming through the village or nearby, and that gets contaminated, it usually means that they will then have to walk further away or paddle further away to access clean water for their everyday needs. So with that context, how do we respond to this? And the way we do it is that recognizing that in the Pacific, people's identity and well-being are pretty much inseparable. And sorry, that's slides jumping ahead. And this necessitates a place-based approach to watershed management for systems health, because of the importance of recognizing the strengths and the challenges or the weaknesses within a community. Having a place-based approach really it gives you a more holistic way in which to tackle the issues with watershed management. So in Melanesia, watersheds connect land, rivers, reefs, and people, which makes the place-based approach not just useful, but a necessary way to tackle this. And as Ama has shared, it gives us multiple level entry points for having interventions take place. From large-scale protected areas upland, we can also be looking at options of rehabilitating or revegetating riverbanks or riparian zones further downstream, to improving everyday activities such as gardening practices. And this is really what the project or the approach that that we will be sharing in greater detail when Alice comes through with her presentation in the lead up to this. So, sorry, after my talk. So just to sum it up again, it's just really these two key points that I wanted to drive home, and that is we really have to be take seriously the context in which watershed management approaches are delivered, or designed and delivered in the Pacific. The Western models that we typically see in action in more developed countries do not or will have to be adapted to fit in a Pacific context. And we know that a place-based watershed model approach is working in the Pacific with clear positive impacts taking place in countries like Fiji, where this has been going for some time now, and also in Solomon Islands and Papua New Guinea, where we are starting to see positive impacts from this place-based approach. And with that, I'd like to hand over to Alice, who will be giving us a more detailed insight into the integrated watershed management project that WCS is rolling out in Melanesia. Thanks.
Thank you, Alec, for that. And as he mentioned, we're now going to zoom in on some of the work that WCS has been conducting, which Dr. Elise Latine will explain. Elise is an evolutionary biologist and ecologist with an expertise in One Health and biodiversity conservation. For over 12 years, she has managed conservation and health projects across Southeast Asia and Pacific, and she currently oversees the implementation of the Kiwa Wish Plus project, applying nature-based solutions to strengthen public health in the Pacific.
Good morning, everyone. Thank you, Amelia, and thank you, Alec and Amma, for your nice presentations and for setting the scene for my own presentation now. So, my name is Alice Latine. I work with the Wildlife Conservation Society based in Fiji. And I'm very happy for this opportunity to talk about the WISH approach, so it's WISH, not WASH, and how we are implementing integrated watershed management in the Pacific. So I'll start by explaining what WISH means. So WISH means watershed interventions for systems health. So it's a holistic approach using watershed interventions to improve watershed health and systems health. It's been first trialed in Fiji and then expanded to other countries in Melanesia. So the WISH approach is a risk reduction strategy in which we work directly with local communities in the Pacific. We receive their free, prior, and informed consent, of course. And then the first step will be to characterize the risk in each of these communities using data that we collect when we conduct environmental and social monitoring. Then we identify the risks that are specific to each communities and we communicate about that with them. And we also work with the water committees in each community to develop water and sanitation safety plans. And these plans, at the end, you have an action plan in which that lists all the actions that are needed to reduce the risk that were identified in the previous steps. And then we prioritize and implement all the interventions that were identified. And then you can conduct a follow-up monitoring to monitor and measure the impact of what you did. And it's a real adaptive management cycle in which you can repeat all the steps again and again. So WISH is really based on a portfolio of interventions at different nested scales. As Amma explained, it's important that we consider all these scales. And so we work at the watershed scale, where we address several risk factors by protecting the forest and restoring and reforesting the degraded areas. And we also tackle erosion by improving agricultural practices and using sediment stocks, for example. And you can see that these different interventions will have an impact on the incidence of several diseases downstream. We also work at the community scale with different types of interventions, like we manage livestock, we improve the water distribution systems, the sanitation systems as well. We create and restore riparian buffers. And then we work at the household and individual scales to, again, improve the water system, but also to change the behaviors and reduce some risky behaviors. And so we conduct a lot of awareness workshops and capacity building trainings. WISH was first trialed in Fiji in 2018 until 2022. We worked in 29 communities in Fiji, 5 watersheds, developed 29 water and sanitation safety plans, and identified more than 300 priority risk reduction actions that were needed. And we were able to implement almost half of these interventions, working with all the stakeholders, so the communities themselves, the government, other NGOs. We worked all together to implement these interventions that fall under different categories. Some nature-based solutions, reforesting, planting new trees, stabilizing the riverbanks, protecting areas, and also improving the water distribution system. So we conducted the baseline monitoring for several risk indicators in 2019, and then we implemented our interventions and conducted a follow-up monitoring in 2022. And what you can see is that the number of communities in the high-risk categories, are we there? Yeah, sorry, there's no, yeah. You don't see anything. Anyway, after all our interventions, several communities moved from the high-risk category to the medium or low-risk categories. So it seems that our WASH interventions and NBS nature-based solutions had an impact, and this risk reduction can at least be partially attributed to the work we have been doing with these communities. So in 2022, we expanded WISH to Papua New Guinea and Solomon Islands with the Kiwa WISH Plus project that's funded by the Kiwa Initiative. So it's a consortium of donors in the Pacific promoting the use of nature-based solutions to support climate resilience. So we are working in Manus Island. It's a small island in the northern part of Papua New Guinea. We also work on Kolombangara Island in the western province of Solomon Islands, and we work on 2 islands in Fiji. So in total, we have 41 communities, more than 8,000 beneficiaries, and 60,000 hectares of watersheds. So we are doing the work right now, but I wanted to present the results of the water quality monitoring that we conducted in Papua New Guinea. So this is Manus Island. You can see the base layer of the map. The green areas are where there was a tree cover in the year 2000. All the colored areas show the areas that were deforested. So you have the older deforestation is in the light colors, and the darker colors show the most recent deforestation. The light green circles show the conservation deeds that we implemented with the communities. So these are legally binding documents that the communities develop and that describe all the activities that are allowed and not allowed in these areas. So mining is not allowed, deforestation is not allowed, hunting is very restricted. So basically these areas are protected and undisturbed. All the smaller dots show the water samples that were collected, and they are colored according to their turbidity level. So the blue samples are characterized by low turbidity, and then orange and red show the medium and high turbidity samples. And we did the same with the coliform contamination. You can see on the north coast of Manus, very good water quality, low level of coliform contamination, while on the south coast you can see that many samples are characterized by high levels of contaminations. So it seems that the watershed on the north coast, where the forest is mostly protected, has a very good water quality, while on the south coast, where there is more disturbance, more deforestation, you can see a much higher level of contamination. So water quantity is not really a problem in Manus. It rains a lot, but water safety is another issue. And so the risk factors that were identified in the water and sanitation safety plans are deforestation, open defecation, that's still very common in most communities, the poor sanitation infrastructure, the absence of water distribution system, pig farming, that's very common along the rivers, and the developments, road development. So we did the same in Solomon Islands on Kolombangara. You can see that deforestation is much more common on Kolombangara because 3/4 of the island are leased to a logging company. But you can see that despite this high level of deforestation, the water quality is quite good with low levels of turbidity. And when you look at coliform contaminations, we also observed very low level of coliform contaminations. And it seems that the fact that all the villages, the black dots, are located on the coast can explain this good water quality because there is less disturbance upstream and no villages upstreams. So the risk factors that were identified in Colombangara are also deforestation, gardening, that's very common, open defecation, still practiced by most communities, the poor sanitation infrastructure, and the damaged water distribution systems. So what are the next steps? So we completed the baseline monitoring, we completed the water and sanitation safety plans, and we are now in the process of implementing all the risk reduction interventions. So that includes some work at the watershed scale, where we protect the forest. We constructed several tree nurseries. We are restoring the forest and also supporting some alternative livelihood options, such as vanilla farming, to give people some options to get some income without deforesting their land. Then at the community scale, we are restoring and creating vegetation buffers around water sources. We are supporting people to create agroforestry plots, and we are improving the infrastructure. And then finally, at the individual scale, we are conducted a lot of awareness events, capacity building, trainings to empower people and make sure that they will be able to keep going after the project funding ends. And this is very important because, as you know, funding is only for a limited number of years. Projects always end too soon. And it's important that we develop strategies to scale up and sustainably finance this kind of work in the future. So one of the components of the project was also about decision support tools that are based on the Bayesian belief networks that Ama presented, and that help identify the optimal suites of interventions that are needed to maximize the outcomes for public and environmental health. And these tools can be used by decision makers in choosing the appropriate interventions for their watershed. We are also looking at the feasibility of creating a watershed fund in Fiji that could capture donor funding, but also funding from the private sector, from the government, and that could be used to support integrated watershed management in the high-risk watersheds. And that's it. I wanted to acknowledge the donors who made this work possible, but also the teams in Papua New Guinea, Solomon Islands, and Fiji, who are really doing a fantastic work on the ground and who make this possible. Thank you.
Thank you so much to Elise and to all of our speakers for really sort of laying out the case of why we're thinking about watersheds. We're now going to have a panel discussion to both talk about some of the work that's happening in the Pacific, but also get other perspectives from people working in different areas about how sort of these kinds of trends or activities or these relationships play out in other contexts. So I now want to invite to the stage, we have two speakers who are joining us on Zoom, so they'll beam in just a moment. I want to invite Alec back to the stage. I also want to invite up Mr. Mixolisi Sibanda. Mixolisi Sibanda is the Climate Change Advisor with the Commonwealth Secretariat, where he leads the work on implementing the Commonwealth Living Lands Charter, a program of work focused on accelerating the implementation of integrated action for enhancing sustainable land management and addressing biodiversity, land degradation, and climate change impacts. He brings over 2 decades of experience working on natural resource management, conservation, and climate change. And then I also want to introduce our speakers on Zoom. The first one is Mr. Timothy Navalulevu. Are they coming up? Yes, yeah. So you two sit, and then we'll have Jim. Yes, here we go. Bula Jim. Can we see him on the screen up there?
Can you all hear me?
Yes, and we're just waiting to see you.
Okay. My camera is on.
It is on.
I can see myself.
Yes. Mr. Timothy
That's
Navalulevu
too big.
is an indigenous Fijian who has a background in community development and applying various fields from WASH, climate change, disaster risk resilience, and natural resource planning to health. And he hopes that one day to host everyone present here in the his beautiful homeland of Fiji. And lastly, we have Dr. Sophie Boisson. Get Sophie? There's Sophie. We'll see here shortly.
Hi, everyone.
Yes, just waiting for you. So Sophie is a technical officer in the Water, Sanitation, Hygiene, and Health Unit at the World Health Organization in Geneva. She supports the development and implementation of health-based guidelines on sanitation, quantifying disease burdens from unsafe wash and strengthening links with disease control programs. Can we see both of them at the same time? Is that possible? Yeah. Can I just grab my notebook to take notes? Okay, welcome both Jim and Sophie in the virtual world. So now I just want to start off with Alec, asking you a question. The watershed work in the Solomon Islands originated from wanting to protect intact forest areas and downstream coral reefs. Can you tell us about how the shift to framing the project more within an integrated watershed and water resource management focus has changed the perspectives on the work?
Thanks, Amelia. So yes, our engagement so speaking from the Solomons perspective, our engagement in the project site on Kolombanger Island started off with this conservation of protecting the biodiversity of our upland terrestrial forests on the island. And this process has been ongoing for a few years. It's been very challenging, and I think that one of the main challenges that we've had is communicating to the local communities and tribes why it's a good idea to invest in protected areas sort of work, protecting the upland forests, because of the perceived lack of benefits from the communities for their everyday living. But when it came to reframing the work through the Wish Plus project and bringing in a health sort of element to it, a human health element to it, that really helped to make it more obvious to the communities and the tribes there why it's a good idea to have this holistic approach with protecting the environment, not only with the like having a protected area kind of approach to it, but also in terms of our other activities further downstream and how these have together can have a positive impact in terms of human health. So I think by reframing it through this sort of integrated watershed management for system health approach, it's allowed us to better demonstrate, and for the communities themselves to better appreciate why engaging in this kind of work is actually a positive for the communities.
Thank you so much, Alec. Now, Sophie, obviously you're coming from a very, very different background, coming from the health side of things. And I was just curious, how often does the state of the environment and its role in transmission of waterborne diseases factor into your work?
Yeah, thanks, Emilia, for these questions. It was, I just wanted to kind of acknowledge the great presentation that we're earlier describing very clearly those linkages between the environment and how that impacts drinking water and sanitation system, as well as the recreational water areas. We heard example of typhoid, leptospirosis, but there's over like 50 pathogens also that we know, and even more that we know are kind of closely linked to unsafe environments, drinking water, sanitation, including zoonotic pathogens, including parasitic diseases, thinking of schistosomiasis, as well as a wide range of vector-borne diseases, thinking about malaria and dengue. So in WHO, we very much focus on human health and diseases. And I think first of all, I think there's a different way through which we integrate this element, the environmental element, through WASH and linking with health. So first, through our guidance, all of our guidelines on drinking water, sanitation, recreational water, promote a multi-barrier approach. So starting really from the catchment area and source protection, treatment of wastewater and sludge so that it's safe when it enters back the environment. And through that as well, the risk assessment and management approach. Alice showed a very nice example of how water safety planning and sanitation safety planning is really used to systematically identify all the risks along the entire system, so including the watersheds throughout the distribution systems and so on. So I think that's also one key element. I would say that there's also, a lot of work we're doing on wastewater environmental surveillance on key pathogens to inform public health response, and also by compiling scientific information on those different pathogens. In fact, a couple of months ago, we just released over 54 pathogen background document, laying out transmission, epidemiology, occurrence, survival in the in different environmental media, so that practitioners can use that information when planning interventions. But I'll stop here.
Thank you. So yes, hearing it come up sort of in a number of ways in terms of the way that you sort of talk about risk. Now, switching gears a little bit to you, Mixilisi, could you speak on your experience with the Commonwealth on watershed management, including sort of enabling implementation and ongoing support of watershed management?
Yeah, thank you, Amelia, and it's a pleasure to be part of this important seminar, and thank you for the opportunity to contribute to it. So many of you might not know, but the Commonwealth is a family of 56 nations spread across the world, in the Pacific, in the Caribbean, in Africa, where we have the most member countries, as well as Asia. And so the Secretariat supports work in all these different countries, and so it's been a great pleasure to hear about the work in the Pacific. Through the Living Lands Charter, which really focuses, is an agreement among our leaders to accelerate the implementation of the Rio targets. The Rio Conventions are the climate, the land, degradation and biodiversity conventions. I think there's been this recognition that actually if we would think a little bit more in integrated ways, would at least be able to move the dial on a number of issues. And I think that framing, that thinking needs to be something that many of us adopt, that we do our work in siloed ways, but actually if we were going to open ourselves to talking to colleagues in different areas, and which is what we realize the complexity of the problems on the ground. It's the health, it's the sustainable land management, and a variety of other things. So with that framing, it's enabled us to do some work and support some work in Southern Africa, in the Zambezi Basin. The Zambezi Basin is about 1.32 million square kilometers. So huge area. It covers 8 countries, from Angola down to Mozambique, and passes through Botswana, Zambia, Zimbabwe, Malawi, and so it's huge. And one of the things that we, at least for us, do recognize is actually a lot of the solutions are known, but one of the barriers is the financing to implement. So we've put quite a lot of effort into helping countries access the kind of financing that's at the scale that's needed to actually put a dent on these issues. And so working with other partners, including the UNCCD, including the Zambezi Water Commission, and the governments, we've been able to support the development of a nature-based solutions project. We're calling it an investment plan. And I think that sometimes we projectize a lot, but actually we need to reframe these things for government so that they realize it's actually an investment into the communities, into the countries, into the ecosystems. And so it fits in very well with their development agenda. The fortunate thing with the Zambezi is that there is already a governance system associated with the basin, and so the Zambezi Water Commission helps with that. And again, this sort of brings up the whole point about nested solutions. And so at that level, there is already a plan at the Zambezi basin level, but countries have also got their own desires and plans and what they want to achieve. And so what the project at least does is it allows that nested approach to be implemented, to find the funding that it needs to be implemented. So at the regional level, the Zambezi Water Commission does that, and then at the country levels, we're working with the countries, looking at the policies, looking at what they need to do to enable the full implementation of those solutions. And then we work with communities as well, and so we've got communities, and this has come out of an exercise that was done at the basin level to identify the most vulnerable, the most risk communities and places. And so we're able to then couch and develop very, very place-specific solutions for the communities. So we're really proud of that work, and I think the partners that have been involved are really proud of that, and it's an ongoing thing. It fits within the broader picture that the Zambezi and the governments, the Zambezi Water Commission and the governments have agreed to do in the next 10, 20, 30 years.
Yeah, thank you so much. And the size of that basin compared to what we're experiencing in the Pacific is just orders of magnitude greater. So it's really interesting to hear how this sort of similar approach applies at multiple scales. You talked about this siloing that we tend to do, and on that, Jim, I want to turn to you now. To ask you about what are some of the ways that organizations can act as a broker to get successful implementation of watershed management, to break down some of these silos and thinking around scaling.
Thank you, Amelia. Yeah, that's a very, very important question that we usually ask ourselves. Can you all hear me?
Yes.
Okay. As we all know, projects have a short lifespan. We're always talking about sustainability, but we also should recognize that governments are firstly established institutions, and it's important for us to communicate well with and make those linkages between communities to understand government mechanics and how to navigate the institutional challenges within government. And so, like for everyone listening in, there's something that I've really come to try and perfect over the last few years, and that's becoming a T-shaped researcher and practitioner. And when I say T-shaped, it's making those linkages from the bottom up, from communities to government, but also at a horizontal level, is making those linkages between government sectors, between government ministries. Because we all know that at most times, like different government ministries and departments, they know what the different roles and responsibilities are of the other government departments and ministries, but they don't really know they find it difficult to coordinate and co-implement interventions. And sometimes that's where we come in. We're always trying to find the alignment between community action and community action plans or community development plans with that of government, and getting communities to understand what the government focuses are. And so in terms of breaching the silos, we actually take these different government sectors, we meet them individually, but at one point we all bring them down to communities and facilitate these sort of workshops or these sort of engagements that allow them to understand what the communities are going through, and the community also the government divulge to them or disseminate where the challenges are or where the intersecting points are. And so firstly, the last thing is that getting government sectors to work together and with each other at community level has become very practical for us, and that has allowed them to break these silos and work closer to one another. I hope I've actually answered that question, Amelia.
Yes, I think really that point about it's not just that organizations need to work together, government sectors need to work closer together, and also government and communities need a way to work with each other in a better coordination. I'm going to turn to you now again, Alec. Implementing WASH programs, as you touched on, in rural Solomon Islands is challenging due to the remoteness and the lack of infrastructure. What are some of the approaches you're taking to address and overcome some of these challenges?
Thanks, Amelia. So I think what's really critical for us is this whole place-based approach, and really like looking at what are the when we're engaging with the communities, we're looking at what are the existing kind of frameworks that are in place, both from a community, tribal sort of level, but also take into consideration the capacity of the government, or in our case, it's really the provincial government. And so when we're talking about WASH, coming into this project, there was very little WASH expertise within the WCS team. So it was really important that we were able to reach out and engage with our partners, like the rural WASH team that's nested within the provincial government administration. They've got years of experience, getting them to actually inform us on, share with us their experience in working very similar communities that we're working with, and really just having that be sort of like the guiding or the guideline on how we should be thinking of engaging with our community as well. It's this whole like trying to think about what is the most appropriate intervention that can be feasibly put in place within a community. But just as important is also recognizing the cultural dynamics on the ground, and being able to work with existing tribal committees that are in place, community committees that are in place, and not be coming in top down with something new to the community, but trying to work with, just the existing framework on the ground with the WASH approach. Yeah. Does that help?
It does, yes. Turning to you now, Sophie. What opportunities do you see within the public health and WASH sectors to better integrate environmental health, and what are the barriers to this integration?
Yeah, well, I really think these approaches are so complementary. If we think with the example, for example, of nature-based solutions, this is really, really important in reducing pathogen loads, so that treatment systems are not receiving as much loads of pathogens. So they all, having this approach to really minimize pathogen load upstream is really kind of complementary to the WASH interventions. So I really like the example earlier, describing this clearly. I think we could, I think there's clear opportunity to do a bit more in terms of, better integrating the kind of the risk assessment and management approach in projects, so that the projects are not really focused on the infrastructure, but have the whole way of looking at management, operation, really having a knowledge and a mapping of the whole systems more broadly, to better understand and prioritize where intervention are most needed and ensure they're complementary. I think there's clear benefits in terms of, we talked about disease prevention, both from pathogen, but also, I didn't mention it earlier, but from chemical contaminants as well, but also of well-being, right? Because if we have healthier ecosystems, we have better livelihood, we have improved livelihood, we have improved overall well-being of population, and I think that's kind of that these are cool benefits that are they're very obvious to everyone. And finally, kind of working, through this One Health lens, with the human, animal, and environment. I think it's something that's obvious to everyone these days. I think we need to do more to bridge those different silos, ways of working. But that comes, of course, with building the capacity to do so and have the technical skills and knowledge to be able to do that.
Thank you so much, Sophie. Mixolisi, to you now, we're hearing obviously about how these approaches are complementary, and I think we've laid out a good case about why we want to do watershed management. What are some of the challenges in scaling up watershed management? And do you have any key tips for success in scaling up interventions, drawing upon your experiences you described earlier?
Yeah, so I think it's probably not things that are new, but I think all of us in our different endeavors, I think we need to realize that we're not the whole and total solution to the problem. And I think that demands quite a shift in the way that we think and work. I think more and more, I think we need to realize actually that collaboration is the way forward, and that the health people can do something, can bring something. Those of us who are coming from an ecological background can bring something, and bring different approaches, and being able to have conversations around those sorts of things. One of the things that at least the work we're doing in the Zambezi has really emphasized to us is that we've brought bankers from the African Development Bank, we've got ourselves from the Commonwealth, we've got the UNCCD, and actually the way that the bankers understand bringing the financing solution, it's just very well scaled, appropriate for the challenge that we face. So I think it's recognizing, one of the key things I would emphasize is recognizing that we've got to bring everybody to the table. It will have a cost because it means that we probably will go more slowly in delivering the solutions that we know need to be delivered. But actually doing that will have a bigger impact, will have scaled impact. So that's the first thing. The second thing I would say is that let's recognize that actually in some places, like Southern Africa, the governance mechanisms are already there. The plans are already there. So it's actually saying to the authorities and the governments, okay, we want to help you implement what's already there. And I think there is always this desire to create new solutions, and I think that there is a place for innovation, but actually there is quite a lot that's already there and that's not been implemented. And how can we actually work together with governments, use the existing governance mechanisms to implement those things at the different scales? So I think that's important. The last point is just, and again it points to this stakeholders coming together, being able to bring different policy sectors together and create some sort of coherence, I think is critical. So those of us working on climate, working on biodiversity, water, and health need to probably be looking more at what we're doing at national levels, and being able to contribute to those conversations, and saying to the folk who are doing health, actually, have you considered what nature-based solutions could do for health? And having a conversation with the biodiversity colleagues, the health colleagues, coming into that conversation at that level and saying, actually, what you're doing, we know that communities use traditional medicines, and there are structures there, and you're already using structures to encourage biodiversity conservation. How can we work together to also address our issues? So much that we have some sort of collaboration at all tiers, really. And I think that's what's needed for where we're going.
Yeah, thank you so much. Obviously, one of the mechanisms that helps with all of this and the scaling and the coordination is money. We heard a little bit about, briefly, about the Watershed Fund. Jim, in Fiji, there is work to establish this Watershed Fund. How can a finance vehicle like this help to scale up these integrated watershed management approaches, help bring people together to be able to have these sort of conversations and coordination?
Thank you, Amelia. Before I get to my just my response, I really appreciate Mr. Sibanda's talk on response to your question earlier. But it really speaks volumes of where government should place investment, and I believe that what the models that Ama and Alice alluded to, and what they described well, and what Alec mentioned about place-based approaches. These are some of the things that government could prioritize, but unfortunately, having too many priorities and commitments, COVID showed us a lot about that, where a lot of the funds, or a lot of government priorities were pushed aside to deal with pandemics. And so having a watershed trust fund that actually focuses on improving or prioritizing interventions where it is needed most, and linking up with the sciences of where outbreaks are happening, where communities are really affected by water-related diseases. These are evidence that, allow decision-making and allow prioritization of interventions at watershed scale. And this watershed fund is actually at an early stage right now, but at the first consultation, it was really easy to see, and we were really happy that our government partners really saw the need to work together to try and bring a sort of a coherent and coherent way of working together, so that they would be able to alleviate water-related diseases in areas where there was a lot of outbreaks. And so I think at this point in time, we all know that our health facilities in Fiji, they're not able to handle inpatient numbers, and so a more proactive, preventative angle of public health is needed more than ever, because we need sustainable financing. And I think this is the way to go. We are still moving up, still getting our information together with models like the ones that Ama and Alice mentioned. And so I think this is something that would help government, but it's also for every a wider group of partners to understand, not only in the Pacific but also globally, and also alluding to what Mr. Sibanda was talking about in terms of coming to the table and speaking to public health practitioners and saying, wouldn't you want it this way, so that it could help alleviate or decrease disease burden in this particular area. So it's some of these things that are coming together, that we are working in slowly, but taking that place-based approach. Thank you.
Yeah, thank you so much, Jim. That was a very eloquent sort of summary of the goals and sort of the ideas behind the Watershed Fund, and really great to hear that there's been such sort of early good responses towards the idea. I want to just turn it over now to some questions for the audience. If you have any questions for any of our panelists or for Ama and Elise on the work that you've heard today, or reflections in places where you're working, where you do or don't think about sort of watersheds or water quality as part of your work. Yep. Do we have just up there?
So sorry to make you run all the way up the stairs. Thank you. It's Robert Bradburn. I am the Chief Scientist at the England Environment Agency. in England, of course, we have a very industrialised and institutionalised way of managing our water, and yet we have huge calls for us to improve the sanitation of the waters where many of our people go for recreational purposes, and they bathe and they pick up diseases and they complain about it and they don't like it and they want us to do something about it. Now in England, there's a real danger of people saying, it's that person over there, they're doing this to me, it's their fault, get them to do it. Now from what we've heard today, we've heard some really inspiring stuff about how to engage communities and to get people to realise that they are part of finding that solution. So what can we learn from in England from the work that you're doing? And do you see there's a danger in any of the places where you're working that you're heading in that direction, that you're heading to the position where people are saying, actually, it's not my problem, it's someone else doing it to me?
I'd like to take that on.
That's a very difficult question. As you spoke, I just thought, I live in Brighton and we've just had a problem with sewage going into the sea, and we're all screaming about how bad the water companies are. And then, trying to reflect and, counter that with the experience in perhaps Southern Africa, the Zambezi River. I just think that there is a danger, actually, because one of the points I didn't mention, but that's something that we're really looking at, is how do we bring on the private sector to invest in the basin. And I think we could probably, in maybe another 20, 30 years, you have the private sector playing a bigger role and then everybody disappearing and leaving it to the private sector. So I think that's a real risk. I think that perhaps at a policy level, in England, there is more need to actually work with communities more and actually talk about their responsibilities and what roles they play. Which I don't think really happens, and communities really get the water and, at the tap or got to the beach to relax, and they don't realize they're actually part of an ecosystem. And as a resident of Brighton, I probably need to engage a lot more with the management, and that might require at a policy level, someone to be reaching out and actually educating and saying it's not just the responsibility of the private company, that is the responsibility of making sure that this water is safe and clean, but it's all of us' responsibility. Perhaps that's something that we need to think about, some sort of a communication strategy to actually do that.
Okay. And to Alma, because you might have thoughts on your models and how they can help.
Just another point on that, with that being a problem with, for one of my slides, I just had a QR code on that paper that was summarizing some of the different indirect and direct impacts onto human health and ecosystems. As part of that, we also talk to a lot of people who look at trying to improve water quality in different contexts and some of the challenges and problems that have come up in the past. And one of them is that trying to bring different people to the table, especially the people who might be contributing pollution, is a really challenging part of that. And so in some of the recommendations for, particularly in regards to developing a watershed fund, having a really wide range of stakeholders, trying to bring them on really early in the process, especially in regards to, most of the time it's really not nice, but often it is kind of like, if it's not frequent, that'll be like one individual company or source pollution that might be contributing to these events, but when it is, it's always like, can't believe it's, Cadbury, or I don't know, whatever it is, contributing to some kind of pollution. Often it'll be like really diffuse, so it's really hard to identify who it is. So it's kind of hard to figure out who the finger's pointed to, and it might feel very disproportionate for some particular polluters or different people. But I think one of the recommendations was really trying to identify what some of the benefits might be for those individuals as well. So like not just shoveling all the responsibility onto those companies, but trying to identify co-benefits. So like, for example, for agriculture, there's been really cool examples in like different areas as well, finding benefits for them as well. So increasing yields as well. So really working together with those groups and bringing them on early on in the process. But obviously complicated and lots of challenges there.
Thank you. Do we have other questions from the audience? I might ask a question for you, Sophie. We sort of heard a little bit about, from Mixolisi, about the importance at that sort of national level of bringing the different sort of ministries together to talk about, bringing health and biodiversity conservation together. Obviously, the role that the World Health Organization plays in terms of that sort of international and national level. What's the sort of, how does that come up in your work in terms of how the World Health Organization engages across those different sectors to sort of bring those conversations up from the international to the national down to place?
Yeah, so obviously through our normative guidance and through the whole WSP and SSP processes actually supports the use of coordination platforms across different stakeholders. If we think about sanitation, of course, it's very fragmented sector. So doing an improvement of the sanitation in a specific area requires, multiple agencies talking together, and that's happening at the local level. So what we provide is guidance and tools to be able to implement those approaches and recommendations and apply them more at local level. So we also support, capacity building activities, supporting countries and partners on how to do that. As well. And just to pick up while I have the mic, just to pick up on this issues of, I think, public trust. I think, as highlighted earlier, I think communication is really essential. And, the public health oversight, is really crucial, having this transparency as well and being able to communicate regularly to the public, water quality results, information quickly, early warning systems, etc. I think also kind of help build confidence in the system as well.
Thank you. And a last question for you, Mixolisi. As the Commonwealth, you obviously said you're in lots of different countries and you're implementing the Living Land Charter across different countries. Obviously, we've heard about, in Fiji, we went from different communities within Fiji and have now scaled up to Solomon Islands and Papua New Guinea. How much within the work of the Living Lands Charter also includes sort of that peer-to-peer learning across the different countries that are implementing these kinds of activities?
Yeah, so just in terms of the structure of the way that we delivering this program is our member countries are driving it. And so we're hoping to really create a platform where they can actually exchange ideas and learning. And I think we invite others, different work that you're doing, to come and speak to the different governments. And we've created what we call thematic working groups, where, for example, on water now, Malta is leading that, and very, very open to really that kind of exchange of knowledge and being able to get solutions from one area, and others can look and adapt for their own countries and regions as well. So that's how we're approaching it. And I think I must say that in most of, at least the smaller member countries, there is a huge appreciation for that kind of exchange of knowledge. And I think for the Pacific, you could exchange incredible insights with the Caribbean region, with some of the small island states as well from Africa. And so there is that huge opportunity. And I think in the spirit of what we've been saying in this session is I think we need to start working together and seeing what solutions WCS is doing, and that we could bring and highlight and expose to other countries elsewhere, so that the solutions are not just scaled for the Pacific, but scaled more globally and for other regions as well.
Yeah, great. And that does lead me to my final question for both Alec and Jim, which is the Pacific is rather underrepresented at this conference. I mean, there's obviously a geographic component to how far away the Pacific is. Alec can tell you all about the long journey that he had to take to get here. What is one thing that you would want listeners and participants both to know about the Pacific and to take away sort of in how we should think about the Pacific and the lessons that we can really learn about what the Pacific is implementing? And I'll turn to you, Jim, first.
Okay, thank you very much, Amelia. I think from where I sit, the Pacific is not usually prioritized in terms of global geopolitics, because our population numbers are smaller compared to places like Africa or Asia, or Southeast Asia, generally speaking. But the population of where we sit is actually the largest ocean in the world and the drivers of climate change. And so, we experience these sort of impacts on a regular basis, on a daily basis. So having, a wider sort of participation and attendance to these events allows us to actually amplify, what's happening here in the Pacific, and actually get more support at a global level in terms of when it comes to creating SDGs, or the formulating of SDGs. What would be the next 15 years look like, and how do our voices contribute to that? So I think that's something that I just like to put out there in terms of
Oh no, your sound is cut out. A second. Hold on, your sound is cut out. Oh, I might. No, it's gone. I might turn to you, Alec, to answer from your perspective.
Thank you, Amelia. I think just to build on what Jim is saying, I think with the right the support from the global community, I think flexibly designed sort of projects for the Pacific is really critical for us to be able to go forward with improving our approaches with watershed management, or just water management in general. And I think this is something that really needs to be taken seriously when it comes to donors coming up with ideas in how to support or help the Pacific Island setting. So I think that really is something that I see as being really important. Just that need to provide a flexible funding sort of avenue, but also an approach in terms of the time, as Mixolisi was saying, mentioned earlier. Like, it does take a lot of time and effort, especially in a country like Solomon Islands, where it's really challenging working with the government, which is usually very under-resourced, and dare I mention the C word, but there is that level of corruption as well that you have to face in engaging with project activities in the country. So it's very challenging as a development partner, WCS and others, working with the government and communities, giving them the space and time to be able to adjust and appreciate what we're trying to do with projects is really, really important.
Thank you so much. I think that's a great way to end the session. I hope that you've come away with hearing about why we need to think about watersheds, not just as a source or thinking about water scarce basins or water quantity, but really as the place that for health, for human health, for ecosystem health. Sophie alluded to the over 50 pathogens that are waterborne or environmentally oriented pathogens, and so watersheds provide a really great opportunity to address these sort of multiple co-benefits, which we're hearing are we increasingly in a resource-constrained world thinking about how we can maximize the benefits. And hopefully have learned a bit about different approaches being undertaken. So with that, I want you to give a big round of applause to our speakers and our panelists, and really appreciate you coming. I just want to take a picture, Sophie and Jim, of us